Hemorrhoids, what a pain in the ass. Well, in this video, I'll tell you exactly what are hemorrhoids, what are symptoms from hemorrhoids. Wait to the very end of the video, I'll give you my recommendations of what you can do at home to help out with your hemorrhoids and what I can do as a doctor to get those hemorrhoids fixed. Guys, let's talk about poop. Howdy y'all, Dr. Samir here, aka your poop guru, trying to give you the best tips and tricks to help out with your health. If you haven't already, don't forget to smash that like button. Like, share, subscribe, turn on notifications, and if you haven't, make sure you sign up for my weekly newsletter where you can get great poop tips just like this one. Hemorrhoids. Literally a pain in the bottom. I have so many patients who come see me because they have hemorrhoid issues, and they've also heard that hemorrhoid treatment can be very painful. No, that's not the case. So in this video, let's discuss what are hemorrhoids, what are symptoms from hemorrhoids, and what you can do at home, and how I can fix them. So hemorrhoids are dilated veins in the rectum that become very enlarged and very big from any number of different reasons, whether you're sitting down for a long time, straining, trying to push out that bowel movement, constipation, lifting up heavy things. Yes, you deadlifters, that is y'all. Or if you have a lot of problems going to the restroom, that can also cause hemorrhoids to occur. So that pressure will inflate the veins, make them larger, and have you develop hemorrhoids. So there are a lot of symptoms that hemorrhoids can occur, whether it's bleeding, pressure in your bottom, not feeling like you're completely clean, itching, or burning in the rectum. All these symptoms can be associated with hemorrhoids. However, the important thing I want you to know is that those are not only symptoms of only just hemorrhoids. A lot of different conditions can also mimic hemorrhoid type symptoms, whether it's colon cancer, colon polyps, ulcers in the bottom, a fissure, which is a tear in the rectum. And so a lot of different things can mimic hemorrhoid symptoms. This is why it's very important whenever I see somebody who has hemorrhoid problems, the first thing I do is I take a look. Yes, I literally look at your bottom, and I may have to feel what's going on and see what's going on. I know this sounds very weird, but keep in mind, I'm your poop guru, and it's a dirty job. Somebody's got to do it, and that's me. And so we want to make sure what is going on. Now, if somebody is having symptoms from hemorrhoids and I'm not quite sure what's going on, I may go ahead and do what's called a colonoscopy, where I actually look inside with the camera to verify there's nothing else going on there. One of the more common things I always worry about is whether your symptoms could be a sign of something growing inside your colon. And so what I tell everyone who comes to see me is that just because you assume you're bleeding from hemorrhoids does not mean that is the only reason that you're bleeding. I don't want to make an ass out of you and me by just assuming that. And so we want to do thorough investigation, want to see exactly what's going on, because we're seeing more and more people who are developing hemorrhoid symptoms such as bleeding or itching, and later we find out those are symptoms of a precancerous lesion that will eventually lead to colon cancer. Hey, if you're getting value from this video, I would appreciate if you smash that like button and comment down below. Now that I scared the bejesus out of you when it comes to hemorrhoids, what can you do to get them taken care of? So, number one thing I want you to be aware of, don't remove hemorrhoids on your own. Don't do that. Don't get any scissors, don't get any knives, don't try and cut it open. That is a no, absolutely don't do that. You need a medical professional to take care of them. Now, there are two types of hemorrhoids, internal hemorrhoids and external hemorrhoids. So internal hemorrhoids are the ones that typically cause symptoms, pain, bleeding, itching, and pressure. External hemorrhoids most often do not cause symptoms, but they don't look very good. And so different treatments that we offer for both those two. Internal hemorrhoids, what you can do at home, soaking in a sitz bath or hot water or warm water actually does work. That actually relieves the pressure when it comes to hemorrhoids and allows them to go back in. And that's what we want, guys. We want hemorrhoids to just go back in. But other things you can do, including things like Preparation H, witch hazel, or hemorrhoid creams, do work. What they do is that they help decrease the pressure in the rectum, relax the bottom, and allow those hemorrhoids to go back up again. Now, if you're suffering from constipation, that needs to be addressed as well. And so even though we can fix the hemorrhoids, if we don't fix the root cause of those hemorrhoids, whether it's constipation, sitting down for a long time or lifting heavy things, you're going to keep on getting hemorrhoid issues. Now, these are all temporary fixes when it comes to hemorrhoid issues. It doesn't actually fix the problem. It relieves the symptoms, but I will tell you, once you've had hemorrhoid symptoms, there's a very good chance you're going to keep on getting symptoms over and over and over and over and over and over and over again until you come to see me to see what we can do. So we offer permanent fixing of those internal hemorrhoids. It's called hemorrhoid banding. I have a video on this as well. It's a very easy, effective, and painless, yes, painless procedure. We do it in the office. We place a small little rubber band around those hemorrhoids. It strangulates them and they go away. This is much different from the surgical option because that is an option as well. But surgery, it sucks. It is terrible. All the horror stories that you have heard about hemorrhoid treatment comes from these surgical options where they cut out those hemorrhoids and people are in pain. It's discomfortable. You have to wear a donut. It is not fun at all. And so a lot of people are scared to come see me because they've heard about these surgical options and they are scared to death, rightly so, of the horror stories from that. Don't let that be you. I don't want you to suffer from hemorrhoids. Come see me because we can fix that. Now, the other type of hemorrhoids are external hemorrhoids. Now, these hemorrhoids typically do not cause symptoms. No matter what you think, no matter what your friends think, external hemorrhoids typically do not cause any symptoms. They may not look very good, but they don't cause symptoms. And so the only reason to get those fixed is they don't look very good or for aesthetic reasons. So my recommendation is don't look at them. Simple as that. And if you do want to get those fixed, I will tell you, it is a pain in the It really is, because it involves a surgical treatment in which they can do surgery to cut off those external hemorrhoids. The recovery is very difficult. That area is very difficult to heal. It is something I do not recommend to anyone who wants to go down that route. Guys, I want to thank you for watching this video. My question today for you, what questions do you have about hemorrhoids? Have you tried treatments? What over-the-counter things have worked for you? Comment down below. I'd love to hear what you guys have to say. I want to thank you for watching. Don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to my weekly newsletter where you can get great tips just like this one. Guys, I want to thank you for watching. Have a great day. Thank you. If you're wondering what options I recommend to get your hemorrhoids fixed, click over here.